Good morning, everyone. This is Sterling McNeil with Church Health, and I want to welcome you to connecting the community to WIC and SNAP. Today, we are going to have a wonderful day of information and training on the SNAP and WIC programs, the Supplemental Nutrition Assistance Program and Women, Infants, and Children's Program. We have our friends from the Tennessee Justice Center with us today. We have Emily Sherwood and Anna Luttrell, and later on, we will have Signe Anderson that'll be joining us. So let's get started, let's get going, and we have a lot of good information that we are looking forward to having. So Signe Anderson is the Director of Nutrition Advocacy. Before coming to Nashville, Signe worked at the Food Research and Action Center, a leading national nonprofit organization working to eradicate poverty-related hunger and undernutrition in the United States. As a senior child nutrition policy analyst, she led FRAX, which is the Food Research and Action Center, relationship with dozens of partners across the nation that provide free, healthy meals to children, even when school is not in session. Her work at the TJC is focused on increasing awareness for the summer and after school meal programs to grow the number of children who receive meals, as well as the SNAP and WIC programs. Emily Sherwood is the nutrition advocate. Emily's passion for nutrition and food security was first cultivated in a small family farm where she grew up. She eventually translated that interest into a degree concentrated on environmental sustainability and food security at Sewanee, the University of the South in Tennessee. Emily's work at TJC centers around communication, education, and advocacy surrounding the federal nutrition programs. Anna Luttrell is a nutrition client advocate. Anna is originally from Southeast Tennessee, born and raised in McMinn County. Having just graduated from Washington and Lee University in May of 2021, Anna just started as a nutrition client advocate at TJC in June. She had been interning part-time with TJC's nutrition team since summer of 2020. She's primarily does nutrition casework and is dedicated to understanding federal and state SNAP policy, and also has been a part of TJC's ongoing PEBT advocacy and casework efforts. Welcome, and we turn it over to the Tennessee Justice Center.
Thanks, y'all, and thank you everyone for joining us this morning. We're super excited to be here. I'm gonna share my screen real quick, and then we'll go ahead and get started. Can everyone see my screen all right? Great. Welcome. Thank you so much for being here this morning. We're going to be talking connecting the community to SNAP and WIC. Before we get started, I just wanted to do a brief introduction of our team and the work that we do at the Tennessee Justice Center. I'm Emily. Anna's also on the line this morning, and Signe will be on in a few minutes, but I'll skip over this slide because we had such a great introduction in the beginning. A little bit more about our work at the Tennessee Justice Center. We're coming from the nutrition team at TJC. Our mission is to end hunger in Tennessee by protecting and strengthening SNAP, WIC, and child nutrition programs. And we do that through a few different buckets. So one of the biggest ones is direct client casework. So primarily Anna will help folks connect to SNAP benefits, or if folks were wrongfully denied from SNAP, she'll help communicate with our state and local agencies to make sure that those folks get back on benefit programs. And then we take what we learn from that direct services client casework to advocate for solutions that would allow the food assistance programs to better serve our clients and folks in Tennessee who need to access these programs. That's part of our work. The other part is a lot of communications, especially over the past couple of years because of the pandemic. There have been so many updates to the food assistance programs and folks needing to access them for the first time. So a lot of our work centers around getting the word out and doing outreach on these programs. We also host monthly webinars on different topics related to the food assistance programs. This month, we're doing one on hunger and homelessness. Next month, we're doing one on connecting seniors over the age of 60 to the SNAP program. I can send some information out after this if y'all are interested in joining us for those webinars, but that's part of our work as well. We also host a couple different anti-hunger coalitions, one of which is specifically geared toward college hunger and helping connect college students and college advocates to food assistance programs. We also host a SNAP and Immigrants and Refugees coalition, helping connect immigrants and refugees to the programs and also advocating for solutions that would allow the programs to better serve those specific populations. And the last part of our work is advocacy. So we do advocacy administrative and legislative related to making changes on a broader level to these programs that would allow them to better serve folks in Tennessee and beyond. And I also wanted to mention that while we are coming from the nutrition team at TJC, the Tennessee Justice Center also does a lot of work connecting folks to healthcare resources. So TennCare or other things like that. It's very similar model to what we do. They do direct services and also advocacy. So if anyone on the call needs more information about TennCare or advocacy related to TennCare or how to connect folks to that program, we're happy to refer you to someone at TJC that can answer those questions. And I wanted to do a brief overview of some of the federal nutrition programs. Today, we're going to dig really deep into SNAP and WIC, but there are also a few other programs that are really important to the clients that we serve in Tennessee. Many of these other ones are for younger children. I wanted to specifically highlight the National School Lunch Program because it's been such an important program over the past couple of years. We've been doing a lot of work on pandemic EBT, which for those who don't know is a benefit meant to replace free or reduced price meals lost during COVID because kids weren't able to go into school and get those meals. So this would be kids who were enrolled in free or reduced price meals before COVID. They would go in and they would get like their free breakfast or their free lunch. And for a lot of children, that's their most stable meal for the day and oftentimes one of the healthiest meals in the day for them as well. So when kids had to go home and quarantine and schools were closed, they were missing out on those free or reduced price meals. So the government translated that into a benefit card, functions very similarly to a debit card or a SNAP EBT card for parents to go ahead and go buy groceries to replace those free meals. So that's a program that we've worked a ton on over the past couple years that has been really important to Tennessee families and specifically children. We're not going to go a ton into PEBT on this webinar, but if anyone on the line is doing PEBT work or is helping connect parents to the benefit or just wants more information on it, I have my email and Anna's email at the end, and we're happy to connect more on PEBT offline. But I wanted to just emphasize the importance of all of these programs and how they function together to make sure that folks in Tennessee and beyond are getting the food assistance that they need. So we're going to start off just going over hunger in Tennessee in general, and then we'll go more into how SNAP and WIC can help and how to connect folks to those programs. And then we'll give you all some resources as well. We'll pause at the end of every section for folks to ask questions. And at the end, we'll have a longer time for general questions as well. Oh, and I also wanted to say, if anyone, it doesn't have to be a question either. I know that there are folks on the line who are probably doing great anti-hunger work as well. So if you have anything to add to what Anna and I are saying at any point, please do so. We're eager to hear from folks on the line. So before we start off, I want to just acknowledge the intersectionality of hunger and to think of it as a holistic issue and to acknowledge the other challenges that face many people who are also facing food insecurity. So oftentimes people who are food insecure are also housing insecure, might have insecure unemployment, inadequate health care, and we see those being directly tied to racial disparities, gender disparities, and health disparities. So I put this little graph over here specifically that's focused on food insecurity during COVID, and we see a disproportionate amount of Black and Hispanic folks experiencing food insecurity during the pandemic and beyond because of factors like systemic racism. So I think that while today we're going to focus a lot on how these food assistance programs can address hunger, that it's important to acknowledge the causes of hunger and these other disparities that are often rooted in racial and gender injustices. And a little bit more on COVID and hunger. COVID has obviously had a huge impact on food insecurity in our state and beyond. Before the pandemic, about 1 in 7 Tennesseans were food insecure, which is already a very high number, but the pandemic has intensified that number to include 1 in 4 Tennesseans experiencing food insecurity. So we've heard from partners across the state about what that has looked like for them. Many of our partners at food banks have talked about seeing like some of the longest lines that they've ever seen. And a lot of folks who are navigating these anti-hunger food assistance resources for the first time. So whether that be like needing to find out where their nearest food bank is and how to operate, or how to sign up for SNAP, or how to get information about WIC. During the pandemic, a lot of folks have had to kind of figure this out for the first time, which is why outreach and communication, especially in different languages, has been so important during the pandemic, because a lot of folks are needing to access these programs for the first time. We've seen a lot of families being hit particularly hard, especially with little kiddos as they try to manage at-home schooling and stuff like that. PEBT was a big help for that, but still definitely we've heard from our clients that it's been a challenge to feed kids while they're home and find childcare and everything like that. And also immigrants facing limited food access. I spoke a little bit about this earlier, but we've seen a lot of issues come up with communications not being in other languages about these really important updates to the food assistance programs. So language access has been a huge thing, and we'll get more into that later when we specifically talk about SNAP and WIC. But these are some of the challenges that we've noticed and heard from our partners during COVID, and certainly many of them existed before the pandemic, but definitely wanted to acknowledge that it has intensified all of these issues. And then I know that some of us on the call today are health oriented, and certainly it is an important aspect of nutrition and food insecurity to talk about as well. So I wanted to go a little bit over the impacts that food insecurity has on our health. So for health status, developmental risk for our younger kiddos, mental health problems, poor education outcomes, and also how we see that present. So anxiety around food, purchasing food for the month, parents maybe sacrificing a meal so kids can eat, kind of eating the same things over and over again, decreased nutrition quality, and inadequate food take, not eating enough food. And all of these programs can help with that. So SNAP and WIC, we're going to talk about today, but also, all of these programs that are geared toward children impact a ton of kids across Tennessee as well. And just wanted to go into a little bit more about the health impacts. So health-related costs of hunger and food insecurity in the US for children and adults are estimated to be at about $160 billion. So we know that food insecurity leads to worse health outcomes. So folks who are food insecure are more likely to experience diabetes, heart disease, poor overall health status. We know that a lack of access to healthy, nutritious food is an indicator that these other health impacts will also probably be present. And then coping mechanisms of not having enough to eat. I wanted to specifically focus on adults foregoing food. We hear about that so much in our casework and also from our partners. So adults who might sacrifice a meal so their kids can eat, having to make trade-offs for the month. So having to choose between paying an electric bill or buying groceries for the month, foregoing like medications that folks might need for the month to buy food or vice versa. So we hear about a lot of trade-offs that folks have to make for the month in order to buy food or pay for medicine or make sure that their kids eat, all while trying to maintain a healthy diet. So I wanted to pause for a second and ask folks if they have any broad questions about hunger in Tennessee, and then also open the floor to y'all to talk about what your experience has been with hunger in the communities you work in. What anti-hunger resources do you think have been valuable to your communities if you're already doing work connecting folks to them? And also, what resources do you need to help connect your community to food assistance? We'll provide some of those later, but if anything pops into anyone's mind, this is a great time to talk. And if anyone needs a moment to think about it, I'm happy to come back to these questions at the end of the presentation as well, but wanted to give folks space.
Hi, Emily, this is Sterling again. We are asking people to put their questions in the Q&A instead of the chat. Right now, we don't have any questions so far, but any questions that you have, put it in the Q&A. And if you want to answer the questions that Emily is asking of you, you can put that into the Q&A and we'll pass it on to Emily. And that way it can be addressed.
Excellent, thanks, Sterling. All right, I'll give folks a moment to think about it and we can come back to questions at the end of the next section too. All right, I'm going to pass it over to Anna now. She's going to talk the specifics about SNAP and WIC, what the programs are, what the barriers that we see come up with when folks are trying to access the programs, and how we can advocate for changes to the programs to better serve folks in Tennessee.
Hey y'all, like Emily said, my name is Anna, and I primarily do most of our direct client work on our nutrition team at TJC. So we just want to go into kind of like eligibility criteria for both SNAP and WIC, and then how the application works, and then also talk a little bit about barriers and resources before we go into a more in-depth resource section at the end. Okay, so we'll start with SNAP. SNAP, formerly known as food stamps, is a program. It's an EBT program. Both SNAP and WIC are EBT programs, which means that they come on. EBT stands for electronic benefit transfer, which basically just means that the benefits for these programs comes on an EBT card, which looks and functions very similarly to a credit or debit card. And it's important to point out that the way that SNAP is set up and meant to work is that it's not meant to completely replace a family or an individual's food budget, but rather supplement it, hence the name Supplemental Nutrition Assistance Program. So kind of what that comes out to when you're looking at kind of a monetary value is about $1.40 on average per meal per SNAP participant. And depending on folks' income, it's going to be a little more or a little less, but that's kind of where the average hits at. And like I said, benefits are loaded monthly onto the EBT card. It depends. Your benefit, what day of the month you get your benefit is determined by the last two of your social, but clients will know that, and when they're approved for the program, they'll be told in their approval letter. And EBT cards can be used on debit and credit card machines, and it has a PIN number just like a credit or debit card. So that was several years ago, that was a big transition away from when SNAP when it was still food stamps was actually like a paper benefit. So that definitely helps reduce stigma, among other things in the program. And then what you can buy with SNAP, it's pretty wide reaching. Most all foods, all produce, dry foods. There's a whole list that we've linked here. It's kind of easier to explain what you can't buy. So you can't buy like cosmetic or hygiene items, pet food. You can't buy the one kind of food item that you're not able to buy is like hot prepared foods. So if you're like at Publix or something and you're going through the Subway counter, you couldn't pay for that with EBT money. But so you'd have to like buy the raw ingredients. We just flashed on the right-hand side here, the maximum SNAP benefits per household size. So everyone right now since the beginning of COVID has been getting the maximum benefit for their household size because of a COVID waiver. So every single SNAP participant should be getting the benefit that you see on this, the graph that we have on the right-hand side here for their household side. But whenever this waiver goes away and we're back into normal times, their benefit will be not necessarily the maximum. It's a reflection of kind of where their income falls in the SNAP spectrum. But these benefits just changed last month. So they went up a little bit. And so they were different than last fiscal year. Next slide. So eligibility is calculated. There's kind of two big chunks for how SNAP eligibility is calculated. The first one is income, and the second one are resources. So income, SNAP looks at it in two ways. Kind of the broadest way is your household or an individual's gross income. And SNAP eligibility uses the federal poverty line to calculate gross and net income. So gross income, which is a family's entire income before any deductions are taken out, like any like standard work deductions or rent, utilities, medical bills for some folks. So this is like the amount of money that they get in their paycheck before taxes, which is important to think about because a lot of times folks are only thinking about, how much they're depositing into the bank each month, but actually it is before taxes and Social Security and things like that are taken out. Or if folks don't have earned income, maybe if it's a senior, it would be like their Social Security benefit or disability benefit, different things like that. Things that are excluded from being counted as income are stimulus checks, if folks still have money left over from those. The child tax credit is a big one that cannot be counted as income for the SNAP program. And so the gross income has to be at 130% or less than the federal poverty line. And you can kind of, for reference, on the right-hand side, we have it going up to a household of 4. And then after you deduct things like rent, utilities, different things, then the net income needs to be at 100% or less than the federal poverty line in order to be eligible for SNAP. And I'll flag really quickly, there are some special considerations for certain applicants. So applicants who are 60 or older or who have a disability per the Social Security Administration, they are allowed to deduct medical expenses from their gross income. So this can be really, really important, especially for senior clients who have a fixed income of Social Security or disability benefits. That might not be eligible for SNAP until they can, deduct their Medicare Part B premium or their monthly prescription costs, things like that. But households without a 60 or higher individual or an individual with a disability cannot deduct medical expenses. So that's kind of a little nuance there. And so that's income. And then the resource part of it, most families, so families who don't have a senior or a person with a disability in their household, they have to have less than $2,250 in resources. And kind of the main thing that we think about when we're thinking about resources is money in the bank, whether that's a checking or savings. But this can also be property other than your home, stocks, bonds, different things like that. And then for households that have a senior or a person with a disability, that asset limit is pushed up a little bit to $3,750. And it's looking at the same things. And if you have any questions about things that are excluded. Certain retirement accounts are excluded. Child tax credit is excluded. Stimulus is excluded. And we can send around a list. If you ever have any questions, we can send around a list of those exclusions. Next slide. All right, so how to apply to SNAP. This has kind of been changed a little bit since COVID started. So right now, all of the SNAP offices are closed unless you have an appointment. And that's been, for the past year or more. And we haven't really heard anything about them opening up again anytime soon. So with that in mind, right now, the online application is the easiest to do. So for folks who have access to a computer, or you can do it on your phone too, we recommend doing it that way. But of course, a lot of times there could be technological barriers or not having access to Wi-Fi or a computer or mobile device. So in that situation, there's a couple of different things that applicants can do. They can call their local DHS office and set up an appointment to go do the application in person with a caseworker. They can also ask to print out an application they could pick up from the DHS office, fill it out themselves and return it, whether they dropped it off or mailed it in through the Postal Service. Another really important resource is there's a lot of organizations that have a DHS authorized SNAP outreach grant. So they're actually able to help folks do applications over the phone, where they either help them do the online application or they help them fill out a paper application and then mail it in. So especially for seniors or folks with disabilities or people who are facing, significant technological barriers, these organizations can be a really great help. And we have a link in a couple of slides that links to all the organizations that are across Tennessee. So the actual application, and I'll run through this pretty quickly, but the initial application is like a several pages, and it's just asking for basic information and income, and you're kind of just documenting your eligibility. So then after you submit that, whether it's by paper or online, DHS will process it, and then you will have an interview. Historically, those interviews have been in person, but we're doing them all over the phone right now for COVID reasons, which has been really helpful for families because it's a lot easier to hop on the phone and do an interview than to go into an office. After the interview, the caseworker, the DHS caseworker will determine what documents they need to verify your eligibility. This could be pay stubs, a copy of your rent agreement, your utility bills. So they'll request those, and then folks have 10 days to send those in. So that's pretty fast. Whenever we're doing applications at TJC, and I know all of our partners that also do applications, they go ahead when they submit that initial paper or online application, go ahead and tell the family or the individual, you should probably go ahead and start gathering these things if you have them, because DHS is going to ask for them, and the turnaround is pretty quick. And so if you have families that think they're going to need more time, or if they're going to have significant barriers to getting these things, they should reach out to their caseworker, because the caseworker does have an obligation to assist applicants who are having significant barriers gathering these documents. So then after those three parts are completed, then the case has to be approved or denied within 30 days. And if the case is denied, of course, the client has the right to appeal. And so we do a lot of appeals at TJC. And if anyone has any questions about the appeals process, please ask away, but I won't go into that too much right now at all. Let's see. And I'm checking looks like we have some questions. Let's see. Do y'all want to wait to the end to answer questions, or I can pause and we can take them now?
I know we have some questions that came through, and I think they might have been related to Emily's portion of that. So we can ask a couple of those now. Sarah Blackburn asks, I need to know the guidelines and how to navigate the website. I've helped a couple of people get on, but one recently was rejected. So she wants to know about navigating the website.
I can take that one. The website is difficult to navigate for many folks because you have to create an account, and that can be difficult in remembering user and logins and stuff. But we have a video that we made that goes through like It's about 20 or so minutes long, but it goes through the entire application, like how the online application works, how to log in, how to like which information goes. And so we have that linked later in the slide. And I think that's been a really good resource for both for clients and for advocates too, of just knowing how to navigate that online application, because it can be at times a little non-user friendly. So we definitely hear you there.
And another one she's asking is, what is the income amount listed as low income Tennesseans?
So for SNAP, that's going to be thinking directly about the federal poverty line. So like we talked about, gross income a little bit, it's going to be 130% or less, which like for a household of 4 is going to be about $2,800 a month in income. And then the net income would be at 100% or less than the federal poverty line for that household size. So again, for a household of 4 is going to be about $2,100. So pretty low income.
And from the chat, we have Sarah Smith asking, sometimes patients have a hard time getting to places because of transportation issues. So that can prolong the process of applying for SNAP, but also make it harder to even go to a food bank and et cetera. So are there any kind of workarounds that can make it easier for these clients to get benefits?
My internet cut out for a really quick second right at the beginning of what you said. Could you repeat the question?
You're saying sometimes patients have a hard time getting to places because of transportation issues, so that can prolong the process. So I think you may have addressed the question when you were saying that the interviews and the things are done online or even on the phone. So that will help them to alleviate those transportation barriers and getting there.
Yeah, absolutely. That's definitely my answer to that question. And then 2, I know historically some clients rely on like when you get past that initial application and going to like submitting your documentation. Some clients historically relied on bringing it to the actual DHS office, which obviously then you would have a transportation barrier that could pose there. But there are ways where you can, there are a couple ways where you can submit that online, or you can email in photos. So there's ways to work around it, that part of the application as well.
And what's the workaround for the language barriers?
So all of the, when you're doing the application, and this is something that we talk about a lot with a lot of our partners around Nashville are working with immigrant and refugee facing groups. So the application should be able to be translated into any language, but it's kind of only massively produced in 4 languages. So English, Spanish, Arabic, and Somali. And so that is, poses a barrier for folks who don't speak any of those 4 languages. But when you call the DHS office, you can request a translator to any language, and they have to connect you with someone who speaks your language. And then that caseworker who is able to speak your language would then connect you with an application in your language. But there is that barrier of calling a phone number that answers in English. And so we've talked to clients and partners again and again. That's a big point of advocacy for us and for a lot of SNAP facing partners across the state. And if you all have any clients or know of any families who are having language accessibility issues, send them our way for sure.
And lastly, how do we advocate for a client who has not been receiving the maximum benefit during COVID?
Signe, I don't know if you had something to say.
Sure. No, before we move on to that, on the first question before the language question, it's DHS is supposed to accommodate individuals with disabilities, and so if there are any issues with filling out the application or being able to submit paperwork based on a disability, they're supposed to make themselves available to help that individual. So that's one thing I just wanted to point out to people, that they should keep that in mind. So there's that. And then the maximum benefit, please let us know. They should be receiving the maximum benefit, unless we've run into a couple overpayment issues, which maybe it could be a reason why they wouldn't be receiving the maximum benefit, but we definitely would want to know. Early on in the pandemic, we knew that families were receiving notices with the lower amount listed. So many folks thought they were getting the lower amount because they received that piece of paperwork notice. But once they went and checked their balance, they were actually getting the maximum amount. So we would ask them to just double check to make sure that they weren't actually getting the maximum amount. And if they're not, then we'd like to dig into that. And hello, everyone. Thank you. Thanks for having us. And I'm sorry I'm joining a little late, but happy to be here now.
Okay, so we've had a couple other questions come through, but we can address that a little bit later on.
Sounds good. Okay, and then just to address a few barriers, which we've kind of been talking about these with the questions, general awareness about the program. A lot of people don't know that SNAP exists, or might know what it is, but don't know how it works, or know what it is and think that they might not be eligible, even though they are. This is a huge thing that we think about with seniors in Tennessee. So only about 40% of eligible seniors in Tennessee actually participate in the program. So that's obviously a really low number, and we would love it to be 100%. But that's just kind of a good little statistic that shows there's not always as much awareness about this program as we think. And then knowing your eligibility as well. Like I just said, people might not know that they're eligible, or might not know, or might, think that they're not eligible because they saw on the internet that your income has to be below a certain amount, but then they have all these medical bills that they could deduct and don't know that that could maybe make them eligible. Accessing and completing the online or the application, whether online or paper, which we talked about. Language accessibility is another huge thing, along with accommodations for folks with disabilities. And I would say to that too, if you talk to a family or an individual who was denied from SNAP because of a barrier that was set up, that was created by language access, or by DHS wasn't accommodating their disability, then that's like a kind of an alarm going off to us. Like this could be a good appeal. So that's kind of like what we think about with that. And then I won't get too far into this because I know we're just kind of talking about initial eligibility, but once you're on the SNAP program, there are steps that you have to take every so often to continue your eligibility. And so folks should always be getting notices to let them know when it's their time to recertify, or do some simplified reporting. But we have seen historically in our casework that these notices aren't always timely. They're not always accessible to everyone, whether that be language wise or otherwise. And then submitting paperwork, that's always going to be a barrier to folks, especially those who don't have great technology access to where they could do it online. Next slide. And then just a few tools to addressing the barriers. So we have, we're going to send around a SNAP pre-screening calculator. And this is something that TJC made. It's a really, really useful tool for advocates where you can just go through quickly a client's eligibility. And we'll flash it a little bit later on in this presentation. But basically, you go through all their income and then their deductions, and then it shows if they're eligible or not, and about how much they should be eligible for. So I use that like every single day in my work. And here's our video that we have linked that I talked about earlier on that goes through the online application and how to navigate that. I linked a list to SNAP outreach partners across the state. So these are organizations that do application assistance over the phone. And then this is a really good client resource. It's called Fresh EBT, and it's a mobile app that clients can use to track their benefits. It doesn't show how much is loaded each month necessarily, but it can show like how much they've been using. So that's really useful. And then it can do WIC, SNAP, and if families have Families First or TANF, it kind of tracks all those things at once. It's kind of like an online banking statement, basically. And then, of course, kind of where we and you all come in, providing families with an advocate. So a lot of times with all of our clients, we are their authorized representative on their case, and we can send around that form as well. Basically, it's a form that the client can fill out that allows an organization to speak to DHS on their behalf, which can kind of eliminate a lot of confusion and allow for much more efficient advocacy for your client, and then connecting them to other organizations like SNAP outreach partners. And then we wanted to take time just for, I know we've kind of been answering questions throughout, but to give y'all some time to ask questions and then also pose a few questions for you all to see if you have any thoughts. So do you feel prepared to connect people to the SNAP program? What other questions do you have? Because I know it kind of gets a little complicated. I'm sure there is one. And then do you know if people in your communities are utilizing SNAP, if they're aware of the program, things like that.
And we do have some questions that are rolling in. So is it possible to complete the application and have it faxed in? You mentioned, you're doing it online, and you mentioned you can mail it in or deliver it by hand if you complete it, but can you fax it in?
Yes, you can fax it. And if you just like Google search on Google, like Tennessee DHS offices, it'll bring you to a list of all the county offices and it has all their fax numbers on there. So the best thing to do would just be to fax that to the county office. And there's also email addresses too, if you would like to do that, where you can, all the county offices have a fax, a phone number, email address. So those are kind of different ways to get it there.
And Anna, we can send that link to you all afterwards so that you can find it. You can have it at your ready when you want to contact the county office.
All right. And I think this is regarding the maximum benefits question that was before, but it says, would they be eligible for retroactive benefits?
They should be able if they did not get their maximum benefit for, October or September or some other month that was a maximum benefit month, yes, they should be eligible for retroactive benefits. And I had a case like this recently and was able to get them. So let us know if you have any issues. In a situation like this, it would be like an authorized rep would be good, and calling the county office. That's what worked in my situation. The county office was really helpful and just like was like, oh yeah, they didn't get it that month, but we'll just like manually load it in. But let us know if you hit any barriers.
And at Church Health, we serve the working uninsured, and we have patients that are undocumented. So what resources are available for our undocumented patients, and how can Church Health apply for a SNAP Access grant so we can serve our patients on site?
Signe will be able to speak better to the SNAP Access grant application, I think, but for folks who are undocumented, so SNAP does have a citizenship or not necessarily a citizenship requirement, but an immigration status requirement. And so it gets a little complicated. And if anyone wants to connect with me about this offline, shoot me an email. But essentially, folks need a social security number to apply, or they need asylum or refugee status. And there are a lot of organizations around the state that work specifically with asylees and refugees, and we could totally connect you to them. And then there's also a waiting period. So for people 18 and older, they need to have had a lawful permanent residency status for 5 years or more to be eligible for SNAP. So it's pretty strict for children. So those 18 and under, there's no time requirement. As soon as they're able to get a social security number, they're eligible to apply. The other good thing to know too is that children can apply themselves even if their parents aren't eligible, and they're still going to have to use the income of the entire household, but just because maybe their parents are not eligible for SNAP, they can still be eligible for SNAP. But if anyone has any questions about that, we can connect offline. But when we talk about WIC, WIC has no citizenship requirement at all. So that's a really, really great program for folks who might not have immigration documentation or anything like that yet.
And was the other question about the SNAP outreach grants from the state? Yep. Yeah. So the state does have SNAP outreach grants, and I think there are about 12 organizations. We have a list of the organizations that currently receive it, but we can get more information and send the timeline as to when the state takes on those outreach grants. But basically the outreach grant is for individuals to help people through the application process. I don't know how much detail you all shared about the outreach grants, but it's working with the state because the state realizes that community groups that are working within their community probably are better connected to individuals who might be eligible for SNAP. And so the state gives some grants to organizations to assist with the application process. But we can send some of the details on what the application looks like and what the deadline is for that.
Okay. And one question is, what are the supporting documents that people need to have ready? One person who was saying that they assume that the people have to turn their supporting documents in at the time of turning the application, but they do have a little time to do that.
Mm-hmm. And it kind of depends on the applicant, like what they're going to ask for. So if someone's applying where their primary and only income is Social Security, DHS isn't going to ask for pay stubs from them, and they should be able to just get that information without the senior having to provide, a copy of their Social Security letter. But things like utility bills, if they have one, they'll ask for that. Rental agreements or mortgage agreements, they'll ask for that if you have one. Medical expenses for those who qualify to deduct those. And then sometimes a copy of a driver's license. Bank statements is a huge one. And it doesn't have to be like the full bank statement that you're sent, each month or whenever. It can be like a screenshot of your checking and savings accounts too. But kind of whatever information that you're listing on the application that corresponds with a monetary value, they'll probably ask for verification of that.
And it was briefly touched on regarding the pandemic EBT. Are there pandemic EBT benefits for families of children who went to private schools, daycares, or other affiliated or other schools that are not affiliated with the Shelby County schools?
Anna, do you want me to take that?
Yeah, sure.
Okay. So private schools are also eligible for PEBT if they participate in the National School Lunch Program. So if they do school meals through USDA and follow, the USDA meal pattern and have families apply for free and reduced price meals, a private school would be eligible. A student attending a private school would be eligible for PEBT. And you don't necessarily have to be connected to Shelby County schools. You could be a charter school, but the school has to be participating in the USDA school meal program. And the student has to be enrolled to receive free or reduced price meals.
Okay. And what you have any information on the child only SNAP? They said we have grandparents who have informal arrangements in caring for their grandchildren that could use those benefits.
Yeah, so as long as the way that SNAP determines a household is pretty, it doesn't have to be like, they don't have to necessarily be related or have like a like some kind of formal custody or something like that. But if there's a group of people who are living in a house together and they're paying for food together, then they should be eligible. They are eligible for SNAP as a household. So then the grandparents could apply with their income information to get benefits for their grandchildren who live with them. Hopefully that answers the question.
I think it does.
Okay, perfect.
And another question says, do we call TJC if we have trouble? I have a friend who uploaded her documents. Nashville says they got it, but locally they said they did not.
Yeah, if you all are seeing like systemic barriers or things that are like barriers like this that don't seem like it's not necessarily like application assistance or something like that, definitely give us a call and let us know. I saw another question in the Q&A that was also about clients not getting notices and phone calls in the language that they requested for them to be in. That's a similar thing. If you're seeing that, we'd love to know about that too, because that's definitely a systemic issue and something that happens to non-English speaking clients across the state.
All right. And lastly, Well, actually, I think that is most of them. They definitely want to get access to the links that you have in the presentation, and maybe have access to it later on, so they can apply for the SNAP Access grant and get access to the list of the community partners.
Awesome. Yeah, we'll make sure we're keeping a list. We'll make sure we send everything out.
All right, wonderful.
Okay, and then just to talk briefly about WIC, we can go to the next slide. So WIC is similar to SNAP. It's an EBT program that does provide money for food, but also it does some other things too that SNAP doesn't, because it's a program that's directed towards women who are postpartum or pregnant, or breastfeeding, and then infants, and then children 5 and under. So in addition to like the cash benefit for food, there's also nutrition education classes, there's breastfeeding support, social service referrals, health referrals. So it's kind of looking not only at food, but like the kind of more kind of like a holistic approach to the women and children and infants health. And like I said, it's an EBT program, so money on a card to buy groceries. And if a household is participating in SNAP and WIC, then it'll all just be on the same card. And then it is a little bit different in SNAP in terms of what you can buy. So the list of things you can buy is a bit smaller, and so we've linked it here, and I won't go like too deep into it, but depending on like what who is in the WIC household, so if it's a pregnant woman and a 4-year-old, will determine kind of like what they can buy, because each category of participants, women, infant, or child, has a different list of authorized foods that they can buy. And it's like a lot of grocery stores, you might have noticed this, but a lot of grocery stores these days do a pretty good job about labeling like this is a WIC food, or this is not, because it can a lot of times even just come down to the brand, or if it's organic or not, or the sodium content, things like that. But we've linked the WIC shopper guide here to where participants can look and see the foods that their cash food benefits are eligible to buy. And then kind of continued eligibility, and I can talk about this a little bit on the next slide too, but WIC eligibility is renewed each 3 months, and benefits are authorized in a 3-month chunk, but participants can't access that month's benefits until the actual month that they're authorized for. So every 3 months they go and have another appointment in which they would determine their next 3 months worth of benefits. So eligibility kind of in the beginning, there's 4 parts: income, residential, categorical, and nutritional risk. So income is just looking at your gross income is 185% or less than the federal poverty line. So like SNAP, it's also basing income requirements off of the federal poverty line, but 185% versus 130%. So there are many folks that might be not be eligible for SNAP, but they would be eligible for WIC. And so there is automatic eligibility. So if you have a family who is participating in SNAP, Families First, TennCare, then they're going to be automatically eligible in terms of their income for the WIC program. The second category is residential. So you just have to be a Tennessee resident. You don't need to have any citizenship or anything like that. If you can just show that you have a Tennessee address, then you're good to go. And this doesn't even need to be a driver's license. If you have a utility bill, or you received a package or something that has your name and your Tennessee address on it, then you're good to go. And if folks are having a hard time proving that, that's something we would love to know about. The third is kind of obvious, the categorical requirement. You have to be a woman, an infant, or a child under 5 to receive benefits. And it's pregnant, postpartum, and breastfeeding women to kind of make that nuance. But it is important to note that fathers or grandparents can receive benefits for their infant or their child under 5 that they're taking care of. So they couldn't get benefits for themselves, but they could get an EBT card that has money on it to buy the authorized foods for, whoever they're giving care to. And then the last part is nutritional risk. And basically this just means that the client has been, or the applicant has spoken to, you know, someone who works in healthcare, whether it's someone at the WIC office or their pediatrician or whoever, who has just verified that they might be at nutritional risk. And this sounds like a little bit daunting in terms of like the eligibility, but basically like the way we always talk about it is that everyone, I mean, most all of us could get deemed at nutritional risk for, you know, not getting the adequate serving of fresh fruits or veggies every day, or, you know, different things like that. So that one's not as hard as it seems.
Anna, can I add a few things?
Yeah.
The residential piece, Anna mentioned that you should be able to show proof of residency through a piece of mail. WIC is very county based, so we have heard some WIC counties being a little more strict about the residential piece. So please do tell us if you run into this where individuals are having problems accessing WIC because they don't have the right piece of mail or piece of residential information. They should not be required to have a driver's license because not all people do have a driver's license. And so best practice wise, the counties that we think are doing it right are very flexible on what that piece of mail is or what that piece of identity is for residential proof. And then on the nutritional risk piece, risk sounds so serious, but they do look at this quite broadly. And it's like, do you receive the full dietary guidance of, you know, 5 servings of fruit, 6 servings of fruits and vegetables every day? And if somebody answers no, then they would be at nutritional risk. So that's kind of how low the bar is when it comes to meeting that eligibility requirement. I think we're all at some sort of nutritional risk. We all could be eating better and addressing diet better, but they have a list of questions on that piece that pretty much makes everybody eligible for that part.
And to apply for WIC, so this kind of needs to be done like via conversation with someone at the WIC office. So the way that potential applicants do that is they'll find their county office, which we've linked the county locator there, and then they'll do the application over the phone with like the actual WIC department. So there wouldn't necessarily be a middleman like with SNAP, that's like a SNAP outreach partner, because unlike with SNAP, where you can't actually apply with DHS over the phone, with WIC, you can apply directly with DHS over the phone. And so that's how they do that. And then, then they'll make their appointment and kind of work on the rest of their eligibility. And then every 3 months, they'll kind of do the same thing of having that phone call again. And then some barriers, general misinformation about the program. You know, we'll hear folks a lot of times think that WIC just provides breastfeeding formula, and it does do that, but that's not the only thing it does. There's a lot of other foods you can buy. There's classes, nutrition classes, referrals, really important things like that. So always trying to get the word out about kind of the diversity of kind of what the program is comprised of is something that we try to do, not knowing how or where to apply, especially since COVID, since it's changed, no one's going into the WIC office anymore. This is going to be all done over the phone. So that's been communication that we've been trying to get out, and that the WIC departments have been doing a good job at. And then the last one that we wanted to flag is access to culturally appropriate food. So if you take a look at the WIC shopping list, it's not always inclusive of foods of, you know, a lot of the people who are going to be participating in the program, especially because since WIC doesn't have a citizenship requirement, this is a program that's really a lot of immigrants and folks who might not be eligible for like SNAP are going to be participating in. And it can be very limiting when you know, the foods that are authorized to buy by the program are not necessarily, you know, the foods that they're used to, and that's kind of that they're acclimated to. So that's something that can definitely be a barrier and that we think about a lot as well. And then so I'm looking, it looks like there might be a couple of questions, but then if you all have any questions, or we flashed a few up here. I see someone asked, are there any farmers markets in Memphis that offer WIC benefits? I'm not for sure off the top of my head. Signy, do you know how it works with farmers markets?
I thought there were, but we can double check that one and get back to you on that with an answer.
And then there was a sorry, go ahead.
No, go ahead.
I was gonna say there's a second question about families who are experiencing homelessness, can they qualify for WIC? And I'll kind of speak to WIC and SNAP. The answer is yes. So someone who does not have a permanent address can definitely qualify for either of these programs. It's just they'll need to talk with if you're applying to WIC, I'm going to assume, I haven't actually ever worked with anyone who's experiencing homeless and has applied to WIC, but I assume that during that initial phone call application, they would say that they're experiencing homelessness, and then they would give a friend, family member, or interested organization an address to receive mail at. And it's the same way for SNAP. You don't have to have like a permanent address to receive SNAP, but you just need a mailing address in Tennessee where you can receive those notices, whether, like I said, it's a friend, family member, or like an organization that they're working with.
I have a couple of questions. One, is it possible for a person to be eligible for both WIC and SNAP and receive both benefits, or if you have to receive one or the other?
Absolutely. You can receive both, and you can receive WIC, SNAP, and Families First too if you're eligible for all three. And those it's nice because they'll all come onto the same card. So if you have a SNAP card already and you've been on SNAP, but then maybe you're about to have a baby and you apply for WIC, they can just go ahead and link those benefits to the SNAP card that you already have, or vice versa. If you have been on WIC, but then you're eligible for SNAP and you want to apply and you're approved, they can just link those cards to that benefit, or those benefits to that card.
And Anna had mentioned this earlier, if you are already participating in SNAP, you are income eligible for the WIC program. Right now, the state systems don't talk to one another. It's something that we would like for them to do, but we're trying to raise as much awareness to families who might be participating in SNAP who have young children, that they are eligible as well for WIC. So you can participate in both.
And so another question is, what is the best way to advocate for clients who complain that when they call WIC, WIC will hang up on them when they realize they are non-English speaking?
Ooh, definitely let us know if that's happening, because that would be a civil rights violation and they shouldn't be doing that.
And I have a question is, since the pandemic, were there any changes to some rules or regulations that were suspended or relaxed because of the pandemic? And if there have been, what are the status of those suspensions or changes?
That is an excellent question. Yes, a lot of things changed with the WIC program. A couple of those flexibilities were, one of the barriers I think that Anna may have mentioned. WIC, you always had to go into the clinic in order to apply. You had to physically go in to apply with your children. And because of the pandemic and social distancing and all the reasons for why we didn't want to pull people together in spaces where you could catch the virus, WIC had to flip that and got a waiver to be able to allow families to apply over the phone. So that was a huge change. That has not changed back yet. The WIC offices are open to appointments, but they're still taking applications over the phone, which makes it easier for families that have issues with transportation. That was a big one. Another flexibility they had was with the WIC food package that Anna was talking about. It's not like SNAP where with SNAP, you can go and purchase pretty much anything that you see in the grocery store, as long as it's food. WIC, there is specific food that you can buy if you're a pregnant woman, or if you are shopping for a child who's 3 to 5 years old. And so, because especially at the beginning of the pandemic, we would see shelves wiped clean because people were stocking their cupboards. WIC decided they needed to be a little more flexible on the type of grain that they required people to buy, or the type of type of cheese, for lack of a better example. So they became a little more flexible with what could be purchased in the WIC package. And then the other piece is, in January of this year, they gave more money to families to purchase fruits and vegetables, which was also a great change. But it was set to expire on September 30th. But at the last minute, Congress extended it for another 3 months to the end of this year. Unfortunately, we saw that Tennessee families did not receive the extended fruit and vegetable benefit, but they should be receiving it for November and December. And WIC is in the process of fixing the November benefits. So we wanted to mention to you all on the call, if you have clients or know of anyone who's not receiving the full fruits and vegetable amount, please let us know, because they should be receiving the full amount for November. And it's significant because prior to that waiver for WIC, families received, I think it was $7 or $9 a month to purchase fruit and vegetables, depending on if they were a child versus a mom. And now, because of this extended waiver, Congress has given much more money to families. If you're a child, you get $24. If you're a pregnant woman, $43. If you're breastfeeding, it's $47. And if you're a breastfeeding mother who has multiple children, you could get up to $70 a month to buy specifically fruits and vegetables, which we think is an amazing thing that they should be allowing and should continue. But there were some hiccups with the Tennessee WIC benefit for October. So we know most, if not all, families did not get the October extended benefits. And there are some that are having issues with November. So please let us know. That was a long response to the waiver piece. I hope that was helpful.
Very much so, in answer to the question. And in light of when we've been hearing about the logistical challenges of getting everything around the world today, are there any allowances for food shortages you might see in the grocery stores on the shelves, and are they allowed to purchase their food, like where you purchase online and then you just go pick it up so they can stay distant from others? Are there any allowances for that?
Oh, that's also an excellent question. So unfortunately for WIC, I don't think they're as far along with that, but for SNAP, yes, there are several grocery chains that are set up to accept benefits online, so that a SNAP family could have their groceries delivered. One note there is that any sort of delivery fee would have to be paid outside of the SNAP benefit. The SNAP benefit wouldn't cover the cost of a delivery fee. But SNAP also allowed, in some cases where they aren't able to do the delivery, you could do the online ordering and do the curbside pickup. Like, I think Kroger is one of those where you can do the curbside pickup. But WIC, there have been some pilot programs in the works. I think specifically in Knox County. So unfortunately not in Shelby County, but they're working on that to make it available for WIC. But right now it's not available for WIC.
And another question that I just have, we're talking about, fresh fruits and vegetables and foods that you have to cook and prepare, because you said before that hot meals are not eligible to be purchased. So are there any programs that will give recipes or teach a person how to cook the fresh fruits and vegetables that you have and do it nutritiously for them?
Yeah, so USDA has a SNAP Ed program, and I'm happy to share that link. They do have recipes, they have suggestions, and I think there might be some groups beyond USDA doing some work on that. Some of the food banks do like kids cafes where they do food demos and things like that. But there is some of that happening through SNAP Ed, and yeah, I think there might even be some WIC programs, but again, it's very county based. But we can share what we know. And was there not? Did I answer it? I felt like there was another question there, or I had another thought in my mind to share and forgot it.
I think that was just one question in that one, because I did stack a couple of them before together. But I would like to say that Church Health does have a wonderful cooking program called Cook Well, Be Well. It's a 4-week class once a week that you actually are doing hands-on preparations of food, and teaches some skills like knife skills and how to stock your pantry and different things, and it's good and it's nutritional. You can come and participate in an in-person class. You can do a Zoom class, or you can just take it online and be paced at yourself. So that way that you can see and have access to some recipes and actually how to cook your food versus some prepackaged food that is not as healthy for you. So that's the Cook Well, Be Well class that we have.
That's great. That's great that you guys provide that. And you know what I know? I know what it was that came to my mind when you were asking about prepared food. One thing that I wanted to flag, just because Tennessee has been in the crosshairs of several disasters over the past several years. In some cases, after a natural disaster, the state will provide disaster SNAP, and in those narrow cases, you can sometimes purchase prepared food. So I wanted to mention that, because we have definitely had more than our fair share of natural disasters. And so that's something to keep in mind.
A question the person is asking is that on the application, it asks, do you need an EBT card? And it's confusing for them. They said, doesn't everybody need one? So can you kind of explain what they are meaning by that question on the application?
I can take that one. So that is that's definitely a confusing question, because there is nothing that clarifies why that question is on there. But the reason is, so the SNAP application is also used to recertify cases. So whenever a family is approved for SNAP, depending on kind of the household composition, they'll have to recertify every 6, 12, or 24 months to show their continued eligibility. And the recertification process is done through the online application, or through any through the application process. So those folks who are recertifying wouldn't need a new EBT card because they already have theirs. They're just recertifying, and so they would click no. Or if someone had fallen off 2 months ago but still has an EBT card that they have still maybe had money on or something like that, or still wanted to use, they could click no on that box too. But I totally agree with you that there needs to be a description of why you would click no for that answer, because for anyone who's applying for the first time, the answer is of course going to be yes. Or for someone who maybe had SNAP a while ago but lost their EBT card and wants a new one.
That's all the questions that we have.
Awesome. All right, Emily's going to take it back over from here.
Thanks, y'all. Those are some great questions. I'm going to go a little bit over some resources that we have to flag for y'all and to share after the presentation as well. And then we'll have time at the end for more questions too, if any more pop up. So the first one I wanted to go over was a hunger screening tool. It screens for food insecurity, provides some resources and general information, and then gives information for follow-up. I can send out a link to it afterward, or I can give Church Health the link to send out. But it primarily uses this hunger vital sign tool. So this is a tool that doctors or healthcare professionals will use in their offices to kind of screen for hunger. And then if it's looking like someone might be experiencing food insecurity, then connecting them to the SNAP application, or like Anna spoke about, like an organization close to them that does screening assistance, or linking to the video that Anna talked about, where it walks folks through the SNAP application process on our website. Those are all resources that can be linked to, but this is just a good way to screen for food insecurity when folks are going through their like yearly checkup or things like that. I can send out the link afterward for this. And then another resource, Anna talked a little bit about this earlier, but the SNAP calculator. So this determines eligibility pretty accurately, and then also gives a pretty accurate approximate benefit amount. Here's a little screenshot of what it looks like. So it's a little Excel document, and Anna's hosting a training on that next Thursday at 1 p.m. Central Time. And I put a link in here for folks to register for that. It's easy to use once you know how, but it can be a little intimidating when you first open it. So Anna is an absolute expert, and she's going to walk everyone through it. But this is a great tool to use if you're talking to someone or working with them and you're not quite sure if they're going to qualify, or they might want to know what benefit amount that they would get. This is a great tool to figure that out. So if it's looking like they're definitely not eligible, then they don't have to go through the application process or anything like that. And also a good tool to use to kind of see if we determine someone should be eligible and then DHS says no, kind of gives us an inclination about if we need to look more into if documents were processed improperly or things like that. So please register for that if you're interested. Anna's going to be walking us through that next week. And then just some more information about how to connect families. So a whole bunch of links here on how to apply for SNAP, how to locate stores that accept SNAP EBT benefits, eligibility requirements if you want to read more into that. I know Anna went into some detail on that, but if you want to get into the nitty gritty, that's a good link. PEBT, I know we talked a little bit about that. So if you want to know more about eligibility requirements for PEBT, good link for that. And also if anyone on the call is working with folks who have expressed that they need information about PEBT, or if they're missing benefits for PEBT, we're happy to connect and talk to those families as well. And then finally, just some WIC links, the store locator for stores or other organizations that accept WIC EBT dollars, and also a WIC eligibility screening tool. So this is a great tool, kind of similar to our SNAP calculator, but a little more interactive, that is on the WIC website, that walks folks through what the program is and also helps them determine if they might be eligible. So if folks are like borderline thinking about doing WIC and aren't really sure, 100% sure if they would apply, that's a great tool to send them to for more information. And then finally, just some information about how to stay in touch with us. We have a couple different alerts that you can sign up for if you're specifically interested in PEBT. We have a special alert for that. We send out a monthly newsletter that focuses on updates to the food assistance programs, webinars that we're hosting, anything that we need to flag for our clients as far as if there's like the WIC thing that Signe mentioned, we'll talk about in our nutrition note newsletter as well. I link to our website and our social media as well. Our social media is often the place to get the most up-to-date information as far as like breaking news, if there is something that we need to get out to our clients about a new SNAP thing or a WIC thing or PEBT. Social media often has it fastest, but of course our website and our newsletters are good resources for updates as well. And I have time now for questions. If there are any questions about the resources or SNAP or WIC, we're happy to stay on the line and go over those now.
So we do have a question that came in. It says, so if the WIC program is at Church Health, what would that entail? Would Church Health be responsible for determining if the individuals are eligible every 3 months? Do the children have to be seen by a provider every 3 months, or will Church Health be a resource for their patients?
Sydney, do you want to take that one? I think that Church Health could certainly connect people to their local WIC office and help them facilitate that connection, but couldn't apply for WIC through there. Is that correct, Sydney?
Well, I think, isn't there a WIC office co-located at Church Health? If I'm not mistaken, and if there's a WIC office there, then yeah, it would be the WIC off. You would go to the WIC office and do that. But back to the waivers, you wouldn't have to go in person as long as that waiver stays in place. You could call the county office first. In some cases, with moms who might need to address something with formula, I've heard that in those cases, a mom might need to go in. Because I think oftentimes they can get the actual formula they need if it is a special kind of formula at the WIC clinic. So you should definitely call the county office on that issue. So yeah, if you're co-located, if the WIC office is co-located in with Church Health, which is an amazing model, by the way, this doesn't happen everywhere, but for WIC offices to be co-located in a hospital, that's a great best practice, and I wish it would happen everywhere.
Xenia, this is Sharon. I have two questions. One, I don't think we do have a WIC office in our clinic, but I could be wrong. Okay, so how do you go about having a WIC office in your clinic? And two, if we applied for the SNAP Access grant, how would that change how we're able to serve our patients if we were granted that?
It shouldn't change how you interact with your patients. I would think you would be set up better to be able to do screenings and directly connect people with SNAP. I think that would be an ideal situation. And then for the WIC co-locating, I think the best step is to reach out to the county office and maybe the WIC director. And I've been talking to her fairly frequently this past week or two, so I could ask her about how to set something like that up, because the other option too, like an in-between option, which we've heard other counties doing, and they've done that here in Davidson County, but WIC will have hours at the hospital. If you aren't ready to set up an actual physical WIC office in the hospital, it is possible for WIC to do WIC hours and be at the hospital like on Mondays and Tuesdays or whatever the setup may be.
But the grant monies would allow to have a staff person that could spend time. Could it be used to cover staff hours so that we could have a dedicated person to address SNAP and WIC clients?
So I would have to check on the funding piece for WIC. I'm not sure how that works out, but for the SNAP Access grant, I don't know that it actually covers staff, but it covers like resources and things that you would need in order to do the application assistance. And we could also put you in touch with folks that we know who are participating in the SNAP Outreach Grant, because I think it's also good to get their perspective as well. and that'll give you a better sense of how the funding works for the SNAP outreach grant.
That'd be great. That'd be great. Thank you.
Well, I can say that this has definitely been informative and educational for me. So it's provided some good information that we can be able to share with others to help them, those that have food insecurity. And I do appreciate you all coming into sharing your time, talent, and information with us. We see that you have your contact information online on the slide there. And definitely, if anyone has any further questions, they can send it to us, and we'll do our best to get it answered. We do have this webinar recorded, and we could post it on our site. You can go to our website, churchhealth.org/FCE. So you can see all of our previous webinars and this one here, and you can go from there. So if you have any last comments, any last questions or anything?
I want to say thank you for inviting us, and we're excited that you all are eager to connect people with SNAP, because we can't do it alone. So it's great to have others in the community that are willing to do this work, and so we're happy to share more information and do anything we can to help you connect people, the people that you work with. So this has been a great opportunity for us too. So thank you very much.
And thank you to our participants that decided to spend their precious time with us on today. Thanking you, and have a good day.